Lung cancer, the dreaded disease, kills more Americans than breast, colon, and prostate cancer combined. Tough to spot, hard to treat. Because of the new medical school coming to Austin, the Shivers Cancer Center at Brackenridge has just begun the very first clinical trial on a revolutionary new immunotherapy, the first of 300 trials planned around the country. Now, in the meantime, cancer patients, especially those in stage 3 or 4, wait and hope their traditional treatment does some good. Ron Durst took up cigarettes when he was 13.
That was a thing to do. Everybody smoked. If you to fit in, you smoked.
He quit 10 years ago, motivated by tragedy.
My mom passed away from emphysema, which is smoking related.
In April, the 57-year-old construction worker learned he's got lung cancer, stage 3.
I thought, I'm too young for this, too healthy.
In 2 weeks, he'll learn his chemotherapy results.
You feel lethargic, no appetite. You have to force yourself to eat. You just don't want to do anything. I should know in 2 weeks if it's done the trick.
I'd be on pins and needles.
I am.
Ron is not a candidate for the new clinical trial of immunotherapy, a potential major breakthrough using your own immune system to fight cancer rather than radiation or chemo.
It's a very selective population. It might only be 4 or 5 because it's not appropriate for every patient with lung cancer with this specific immunotherapy drug.
If you're a patient with cancer of any kind and you'd like to possibly participate in a clinical trial, not everyone fits the requirements they have, but check with your doctor. Early data suggests immunotherapy could add years to patients' lives, but more tests are needed.
The only way that any progress has been made in cancer, the only reason we have any treatments at all, is because people have participated in clinical trials. There's no way to know if a new medicine works.
While Ron Durst waits for his chemo answers, he wonders what might have been.
If it would have been available and I would have had that option when I started, I would have been happy to try it.
Any thoughts to smokers out there?
Quit while you can.
Good advice. Austin and Dallas, the only 2 Texas cities in on this immunotherapy trial, but it is the buzz of the medical industry. More than half a dozen giant pharmaceuticals racing to bring new drugs to market. Now, we often hear about cancer stages. Well, exactly what does that mean to the average person? Stage 4 is worse than stage 1, but there's more to it. For background, stages 1 and 2, you have the best chance for recovery because surgery is an option. Stage 3 means the cancer spread to your lymph nodes, so radiation or chemotherapy are likely treatments. If the cancer spreads more, that is stage 4. Chances of recovery pretty slim. Doctors hope to just make your remaining time as comfortable as possible.